Hi, I'm Marco Spadaccini and I'm a fellow at Humanities Research Hospital in Milan. On behalf of my co-authors, I would like to thank Gastrointestinal Endoscopy for allowing us to discuss the result of our recent paper entitled Underwater Endoscopic Mucosal Resection for Colorectal Lesions, a systematic review with meta-analysis. As we all know, the endoscopic mucosal resection is a cornerstone for the removal of flat or sessile colorectal lesions. In the standard technique, a safety cushion between the muscularis propria and the mucosa is created injecting a solution such as saline or more viscous solutions into the submucosal layer. Although the protective effect from the risk of iatrogenic perforation and thermal injury, submucosal injection may paradoxically make snare capture more difficult to be performed. Further, another major concern following conventional EMR is the risk of residual or recurrent adenoma detected at follow-up surveillance colonoscopy, and ranging from 15 to 50% of resected lesions. And despite the wide variability reported in literature, the risk of recurrence remains undeniably an issue. To overcome these limitations, Bittmuller and his group conceive of an alternative way to have the lesion lifted, without any submucosal injection. In fact, they observe at US the behavior of mucosal folds and lesions tending to float away from the muscular layer, and once immersed in liquid. Then they propose to use the liquid infusion instead of air insufflation during colorectal lesions resections. Since its first description in 2012, several prospective and retrospective series have been published, and we systematically reviewed these experiences, collecting data on more than 500 resected lesions. For the purpose of this systematic review, we consider all clinical studies including patients with flat or sessile colorectal lesions treated using the underwater approach. The primary outcome was the rate of complete resection on a per lesion basis. Secondary outcomes were the rate of unblocked resection and the rate of procedure-related adverse events. 10 articles matched the selection criteria and were finally included in the systematic review. According to our meta-analysis, the benefit-risk ratio of underwater EMR is favorable. On one side, we reported both an high complete resection rate and a very low recurrence rate at follow-up, and on the other, an extremely good safety profile. Since the main limitation of our study is represented by the lack of head-to-head comparison with conventional snare-based techniques, we compared the present meta-analysis with previous evidences on polypectomy and EMR. While the 96% of complete resection rate measured for underwater EMR is equivalent to the same estimate for conventional technique, the 8.8% rate of recurrence is substantially lower than the 13.8% reported for conventional technique in a previous large meta-analysis. It could be argued that the minimization of post-resection rate is clinically irrelevant, as most of such recurrences may be effectively treated with the new snare-based resections. However, this is offset by suboptimal compliance of patients with post-resection follow-up, as well as by the risk of not redetecting the scar site or to miss anaplastic recurrence. These, of course, emphasize the clinical relevance of the low recurrence rate observed with underwater EMR. The second main result of our meta-analysis is the high safety of underwater technique. As a 1.5% risk of perforation was previously reported in literature for conventional EMR, at least 8 perforations were expected over 500 procedures. As a matter of fact, the absence of any perforation reassures on the safety of such procedure and may suggest a potential advantage of such technique as compared to conventional EMR. On the other hand, the 2.8% rate of delayed bleeding observed in our review is in line with the 2.6% reported for EMR. In summary, underwater EMR appears as a very promising snare-based resection technique with convincing data in terms of recurrence and safety. While waiting to prove possible superiority to conventional EMR in randomized trial, it may be at least suggested as possible alternative to EMR when dealing with large colorectal lesions. Thank you very much for watching this video, and I welcome all viewers to see our article in gastrointestinal endoscopy.